fantastic audience to be standing in front of. What I'd like to talk about is an issue that's true and very near and dear to my heart, and that's tobacco disparities in African American and LGBT communities. As Travis was alluding to, rates of smoking in LGBT communities are sky high, on the order of 40 to 50% smoking prevalence rates, depending on the community that we're involved in. When you look at African Americans, our smoking behavior has improved very much over the course of the last 10 years, such that our current rates of smoking are about 21%, which are on par with white Americans. That's where the good news stops. Smoking rates are down and equivalent, but all tobacco-related illness the disparities lie among African Americans. Higher rates of lung cancer, higher rates of complications due to diabetes and other types of disorders which are exacerbated by smoking behaviors. As a psychologist and researcher, my work has focused on using interventions to help individuals stop smoking after the point that they've become addicted. What I do know, as other public health people in the room will attest to, is that public health policy is the single most effective means for improving the health of the populations. So there will be many, many things that I will be, and other researchers like myself, I'm not trying to talk myself out of a job or nothing, but there will be many things that we can do to help individuals, but public policy is the most fundamental way to improve the health of U.S. citizens, including disparity populations, whether that's based on race, ethnicity, or sexual orientation. Let me give you an example of how this type of coalition building is essential when we think about public policy and our ability to reduce health disparities. I want to talk to you something about the menthol exemption and give you an example of a public policy that went terribly wrong. It was right. It went terribly wrong in its long-term consequences, because this type of coalition was not at the table when decisions were made at the level of Congress, right? So when we hear organizations and groups talking about holding the line on policy and not taking half measures at any points in time, because we leave out individuals, why? Because it's the most expedient thing to do. We can't take half measures when we're talking about important public policy as it relates to health and health disparities. So I want to go is even as far to say that public policy done in half measures can result in things such as institutional discrimination. What is institutional discrimination? Policies are practiced that disproportionately impact disparity populations. And I'll talk specifically here about African Americans. So is menthol cigarette exemption an example of institutional racism? Let's talk about that. So what's a menthol exemption? In 2009, Congress, as a part of the Family Smoking Prevention and Tobacco Act, did several important things. First of all, gave the FDA regulatory authority over the tobacco industry for the first time. Secondly, they created a ban on the use of flavoring in cigarettes. Cherry, vanilla, any flavor that was known to man, woman, or child in the past, in the present, or in the future, banned. And the goal of that was to reduce youth smoking. Why? Because all the data are very consistent that flavored tobacco products are an initiation drug to smoking and to long-term addiction. Right? All the flavors known to man, woman, and child in the history, present, and the future were banned with the exception of one flavoring, menthol, right? So, and that's called the menthol exemption. And so at that time, even though Congress didn't ban it, they gave the FDA the mandate to determine, to make future regulatory actions based on whether or not menthol, banning of menthol was good for the public health. And for the past few years, millions and millions have been dollars have been spent. I was a beneficiary of some of those wasted dollars to determine whether or not menthol should be banned because it raises, it represents a significant threat to the public health. Now, keeping in mind that the 2009 Act was banned flavorings because it was known at that point to be important for reducing youth smoking, but we've had to spend millions and billions of dollars to now think about what to do about menthol, which should, at that point, should have been a very clear, no-brainer kind of thing. So, what impact has this had? Sorry about some of the formatting issues here. The vast majority of adults who smoke a flavored cigarette smoke a mentholated brand. 40% of youth smokers smoke a mentholated brand. 30% of adult smokers smoke a mentholated brand. If you go back to the basic premise of reducing youth smoking because of flavoring, you would have started with menthol, not exempted menthol. Okay. Okay. The other concern about that, when we talk about communities of color, 80% of black adolescents smoke a mentholated brand compared to 32% of white and about half of Latino and Asian populations. 80% of black adolescents smoke a mentholated brand, yet menthol is exempted. Almost 83% of African American smokers who smoke a mentholated brand of cigarettes. Right? You see there are other disparity populations as well. So what we see is that menthol is a tobacco preferred by communities of color, especially African Americans. And what we see, what I started this conversation was out, is that there are tremendous disparities based on tobacco usage. And here's where my conspiracy theory comes in, and maybe not so much conspiracy because all the data points to the evidence of this, is that menthol is potentially the smoking gun that contributes to these tobacco use disparities among African Americans, and I'll back myself up here with the data. First of all, we want to ask ourselves the question, how is it that one of the most diverse communities, we are trendsetters in style and entertainment and academic, intellectual thinking, how is it that you can get 83% of us to line up to do the same thing, right? Right? 83% of us smokers will line up to smoke a mentholated brand, and not only any mentholated brand, a Newport mentholated brand, such that it's now referred to as the black cigarette. How does that happen? Tell me how that happens. This is how it happens. The tobacco industry spends millions and millions of dollars to conduct focus groups to determine what level of menthol is preferred by blacks. How do we color and brand it? How do we put together advertisements that keep this notion of Newport as the black cigarette, or menthol is for blacks? And here's the tobacco industry documents were published recently, and here's what they said. How to market to black smokers by playing on the image of success, upward mobility, stoking fantasies of wealth and power, right? That's manipulation, right? And they were good at it. Look at this dude. Look, look. I lined up to be him, right? Small back dude right here, right? They spent a lot of money to do that. And we noticed those ads. We noticed those ads. But then so business is business, right? You can work your magic, advertise to adults, that's all good. But there's a sinister underbelly to the tobacco industry. Study out in 2011 looked to see where these types of ads were most prevalent. And we weren't talking about adult settings, we were talking about around school settings. And what the study showed is that in those areas that had a high concentration of black students, we saw higher rates of advertisements in community stores that were focused on menthol cigarettes, right? There were higher levels of advertising for Newport specifically, remember the black cigarette? And that most importantly, because youth are very, very price sensitive, is that the cost of Newports were 12 cents a pack on average lower than in areas that have schools that white students attend primarily. Okay, higher rates of advertisement, lower cost, higher concentrations in black communities, and we think now 80% of black adults, 80% of black students smoking a mentholated brand. It's not by accident, people. Okay. So, the other piece about why this is significant is that menthol cigarettes are in higher levels of addictiveness than regular cigarettes. All the smoking data that you see is that African Americans, more than any other group, will endorse a desire to quit smoking. African Americans, more than any other group, each year make more quit attempts. African Americans, more than any other group, and each year are less likely to be able to quit. Remember, we smoke menthols at 80%. Menthol is associated with higher levels of addictiveness. They're also associated with higher levels of risk. Some of the early studies suggested menthol was not any more dangerous for you other than addictiveness. But there are studies that now are categorically disputing that. And getting it straight back to health disparities. These are data, national data, looking at trends in smoking-related cancers and death based on race and ethnicity. See this line? Although all groups in general are improving, African Americans are still much more likely to die from smoking-related illnesses as well. In particular, males. Pattern is not as extreme with females, but it's extremely true with males. Again, although African Americans, males smoke at the same level as white males, much more likely to develop smoking-related disease, lung cancer, and to die from that as well. So what would happen if menthol had been banned in 2009, 2010? Well, all the computer models suggest that there would be a dramatic reduction in smoking rates, projected out to 2050, under 10%, dramatic reduction, and that the banning of menthol at that time would have prevented 600,000 deaths, primarily among African Americans. Okay. So, last year the FDA concluded that it's very likely, after bazillion dollars of studies, very likely that menthol poses a public health risk above that seen with non-mentholated cigarettes. What's the evidence? Well, it's marketed and targeted to minority and youth, more appealing, much more addictive, much more difficult to quit, and many people wrongly believe it's a healthier option. So, right, all right, FDA has the data that it needs, it's going to do the right thing. No, the FDA still has not done the right thing. But the mayor of Chicago is starting to do the right thing, and supported by the Commissioner of Health and the Board of Health. They have conducted over the last 6 months a series of town halls to educate and put some advocacy around menthol regulation. One of the positive outshoots of this is there are now these campaigns that are rolling out in the black and brown communities, focusing on raising awareness around menthol. And as Kim pointed out earlier, there's some legislation that's currently being considered around increasing tobacco taxes, around regulation of e-cigarettes, and most importantly, for the first time in the country, placing some restrictions on the sale of mentholated cigarettes. In those areas around schools, there has to be a 500-yard buffer zone around schools in terms of menthol advertising. So some things are starting to happen, but this is an example of when this type of coalition, black and brown people who were at the table when they were making decisions about tobacco regulation, may have changed a picture. And I hope that this type of work can be considered as we move forward in thinking about health disparities. Thank you.